Do you sometimes notice strange patches on your child's skin? Or have you seen a baby suddenly twitch or stop, responding for a few seconds? Maybe your child has learning challenges no one can quite explain. These could be subtle signs of something deeper, like tuberous sclerosis complex, TSC. TSC is not just one problem, but a condition that can affect the skin, brain, heart, kidneys, and lungs. It's like a wiring mistake in the body that happens before birth, where cells grow too much and form lumps called tumors. But don't panic, most aren't cancerous. Think of it like a garden, where some plants grow wild and need pruning. TSC impacts about 1 in 6,000 people and can look very different in each person. Some may have seizures since infancy, while others live without knowing they have it. So what causes TSC? Imagine your body runs on instructions from a big instruction manual, the DNA. In TSC, there's a typo in one of two important sections of that manual, the TSC1 or TSC2 gene. These genes normally act like brakes, stopping cells from growing too fast. But if the brake is broken, cells grow nonstop, forming lumps in organs. Now, here's a key point. About 2/3 of people with TSC didn't inherit it. The typo just happened randomly when they were forming in the womb, like a spelling mistake in a text you didn't copy. The other third do inherit it from a parent. So if mom or dad has TSC, their child has a 50-50 chance of getting it, just like flipping a coin. But remember, even within the same family, one person might have seizures, while another only has skin spots. That's how tricky this condition can be. What should you look out for? Let's play detective. In babies, one of the first clues could be heart tumors seen on an ultrasound before birth. These tumors often go away on their own, but they can cause fast heartbeats or breathing trouble early on. What about seizures? If your baby suddenly stares off blankly or blinks rapidly 20 times in a row, that might be infantile spasms, a red flag. On the skin, look for pale spots on the body, like ash leaf-shaped patches, a forehead bump that feels bony, or tiny red pimples on the nose and cheeks. These aren't acne, they're clues. Also, some kids with TSC develop autism, learning delays, or ADHD. In teens or adults, kidney or lung problems may show up, like pain on the side or shortness of breath. Every case is like a puzzle, different pieces, same box. How do doctors know it's TSC? They don't just guess. They look for multiple signs, like doing a treasure hunt across the body. Brain scans, MRI, may show lumps called tubers. Heart scans, echo or kidney scans, ultrasound can spot tumors. Skin check, a special light like a black light, can make those pale spots glow, cool right. Genetic testing will check for those DNA typos in blood. But here's the good news, we can treat this. Seizures, there are special medicines like vigabatrin that work well. Tumors, if they grow too big, doctors may use surgery or drugs like everolimus that gently slow down cell growth. For skin issues, laser treatment can help. And with therapy, speech, physical, behavioral, kids can jump hurdles and shine in life. Early diagnosis equals better control, like fixing a leaky pipe before it floods the house. Can you stop TSC before it starts? Right now, no. Because it's linked to DNA, you can't lifestyle your way out of it, like eating better or exercising. But if you have a family history, genetic counseling is like having a roadmap. A counselor can help you understand risks before having kids. During pregnancy, tests like chorionic villus sampling, or CVS, or amniocentesis can peek at the baby's DNA, though these come with small risks. For families already affected, regular checkups from a young age, brain, heart, kidneys, can catch issues early. So while we can't prevent TSC yet, we can prevent the worst outcomes by staying one step ahead. What's new in TSC? Science is moving fast. Imagine a medicine that doesn't just treat symptoms, but targets the broken brake in cells. That's exactly what mTOR inhibitors like everolimus and sirolimus do. They help cells remember to stop growing. New research shows these drugs might even improve thinking skills or shrink tumors before birth. There's also a push for full body scans in kids with TSC to catch problems early. Exciting trials are testing whether giving medication sooner, before seizures start, can protect the brain. Plus, wearable tech now helps track seizures at night, so parents can sleep easier. One day, gene editing tools like CRISPR might fix the D and a typo itself. That's still in labs, but hope is growing, one tiny step at a time.